Did you know that Nurses Uncorked has a patron program? If you're wondering what that is, join the winery. Yes, it's behind the scenes content. You get early releases to our podcast 24 hours before everybody else. You also get bonus episodes every Wednesday that nobody else is going to hear. And you get free Zoom parties with myself and Nurse Erica that nobody else is invited to, and ad-free episodes and so much more. We really could use your support here at Nurses Uncorked. Me and Nurse Erica would love to continue to do this, and any little bit that you're able to give helps us go a long way. It gets us stuff like equipment. It helps us with traveling expenses. It basically helps us just keep things going. So if you've at all ever considered sponsoring the podcast, we would really appreciate it, and we have a lot of fun. Become the Wine Cork, Wine Bottle, the Vineyard, the Reserve. The list goes on and on. Check out all the options. You guys are going to have a blast with us.
Recently, in the wake of 2 back-to-back high-profile violent attacks against nurses, an industrial hygienist with NNU gave an interview about nurse workplace violence. And in the interview, she stated, quote, "Workplace violence will happen at some point, and it is a part of the disease process for many patients. This message is inconsistent with your message. Did she just go rogue, or does NNU agree with her statements?" Welcome to Nurses Uncorked, where we pop the cork on everything in healthcare.
I'm your host, Nurse Jessica Seitz.
And I'm Nurse Erica.
On Nurses Uncorked, you get real, unfiltered facts and plenty of laughs.
Please follow us wherever you listen to podcasts, and don't forget to rate, review, and download.
Become a member of our winery, where you get early access to the podcast, bonus episodes, ad-free content, and much more.
Now sit back, relax, and pour yourself a glass
as we uncork the truth in nursing.
Welcome back to another week of Nurses Uncorked, the podcast. This is Nurse Erica, and I am here with my lovely co-host, Nurse Jessica Seitz.
Hello.
Hello. And we are joined today by Michelle Mahan. Hi, Michelle. Welcome. Thank you for being here.
Hi. Nice to see both of you and talk together.
Yes, welcome. Well, it wouldn't be Nurses Uncorked without uncorking something. So let's uncork it.
Something, as the case may be.
Nurses Unscrewed. Can we call it that? Do you know that the reason they're not corking stuff, I think, is because there's
a cork shortage.
What the fuck is cork made out of? Where's the shortage? Is it from the ocean?
I don't know, but the last couple of years, there's like a lot of them are switching to screw caps.
Yeah, so we might have to change our name to Nurses Unscrewed, because we have been screwed.
We have been screwed.
Okay.
All right. I bought a new Moscato that I wanted to try and share with you guys.
Oh, for Christ's sake.
Oh, come on with your whatchamacallit every other week.
A Moscato.
What do you drink again?
I'm not telling you. Chardonnay.
There it is. Okay. All right. This one is Castello del Poggio. It is an Italian Moscato with notes of orange blossom, wildflowers, and honey. I don't know.
What's a wildflower taste like? Who's chomping on wildflowers?
Listen.
Wow.
Isn't that nice?
It does sound. That sounds very nice. Cheers. Cheersing me.
Sorry. Cheers.
Gulping it down.
Cheers.
Cheers. All right, let's get into the podcast.
Michelle is the Director of Nursing Practice with California Nurses Association and National Nurses United, NNU for short, which is the nation's largest professional association and union of registered nurses in the United States. In this role, Michelle works with nurses across the country, providing education and guidance as they work together to protect their nursing practice and advocate for patients and the nursing profession.
I guess I will start. So the NNU has been the blueprint for mandated nurse patient staffing ratios for many years, which is wonderful. Where are we currently at with the push for federal nurse to patient ratios?
Well, this is great. I'm so glad you're asking about that because we know we need minimum mandated nurse to patient ratios in every unit, in every facility across this country. And the best way to
Amen.
achieve that is by fighting for it at the federal level. And so our NNU written and sponsored and championed bill for that at the federal level is something that's been part of our policy and legislative advocacy platform for many years, as well as, and so one of the every year we gain more sponsors through coordinated advocacy and legislative lobbying. So where that is we are never going to stop fighting until we have those ratios for every patient in every community in this country. But it will take all of us. And so we encourage every nurse, whether, no matter what access point you find, to participate in having discussions with your senator, with your congressperson, because we do have two bills both in the Senate and in the House for this legislation. It really is also another effective way as, we really do coordinate and strategize, how best to lobby for this kind of bills and who are the best targets. And so where it is right now is we continue to build our power and strategically engage legislators, both in the Senate and in the House, to encourage them to sign on as co-sponsors to this legislation. We do have fact sheets about these on our website under at nationalnursesunited.org, campaigns, nurse to patient ratios. And I also, if nurses are looking for additional ways to get involved, we often have letter writing parties and different ways to engage. So where it's at is we're going to continue to fight, and every voice is needed.
Yes.
Absolutely. How many years has it been reintroduced to Congress? Do you know how long this has gone on?
I don't, honestly, I don't know. I'm sure that we have, I could check for you, but it's at least 10. And I don't know the exact
I think it's
number
around 15 or 16.
That's probably
I'm
more
not
correct.
Sure.
Yeah. I just didn't want to commit to a number, off the top of my head, but it's been a long time, since we've had the ability to do it. And, every time we, come back, to work with our sponsors on this legislation, it gets stronger. We make additional things to make it more powerful, to be a better tool for nurses.
And I've read the entire thing from beginning to end, and it's a great bill. It really is well written and very inclusive, and really kind of considers all possible complications that could arise. And it's well written, and so we need to get that passed. And I applaud.
We've learned so much from our experience in California, right? And so really having firsthand experience with this, in a way, like we just came on our 20th. We just finished the 20th year of having those ratios in California, and there's no magic bullet. So, while it's very important that there's those protections in the legislative advocacy, the most important thing is for nurses to utilize their advocacy muscle every day. And but those lessons learned are, really valuable to us in the most effective use of this tool, as well as the most powerful advocacy for the bill.
Yeah, I agree. Recently, in the wake of two back-to-back high-profile violent attacks against nurses, an industrial hygienist with NNU gave an interview about nurse workplace violence. And in the interview, she stated, quote, "Workplace violence will happen at some point, and it is a part of the disease process for many patients. This message is inconsistent with your message. Did she just go rogue, or does NNU agree with her statements?"
Well, neither. We do hundreds of interviews with the press a year. I mean, I myself, probably at least 5 a week. And unlike a podcast, we don't have final editorial control over what happens, right? And so, at the local level in particular, I don't think it's ill-intended by the press, but sometimes they just miss the point and pull a piece of it. Now, if you read the article that accompanied that, it's very much on message, and I think that's important. Our position as NNU is very clear. We also, just like we have led the charge on ratios, we have also led the charge on workplace violence prevention, winning the most powerful workplace violence prevention standard in the nation in California in 2018. We modeled our federal legislation after that, incorporating lessons learned. Jane Thomason is an industrial hygienist, and NNU, I'm proud to say, is one of the few unions that still has industrial hygienists on staff. And our health and safety program benefits, and nurses benefit immensely from their expertise. Jane herself, as well as our other industrial hygienists, are leading experts on how to keep nurses safe at work, whether it's preventing infectious disease hazards, what types of controls mitigate the transmission of infection, or importantly, what types of measures and policy needs to be implemented to prevent workplace violence.
And as a follow-up to that, I just want to say, and I'm sure that you're aware, many nurses felt after watching that interview, they did not perceive it well. It wasn't taken well. What was your personal reaction to watching that interview or hearing that statement when you saw it?
I can say after working with Jane for many years and very closely, and working with her to lead the charge against the CDC rolling back infectious disease protections, working with her on workplace violence prevention, that frankly, what I know is she is one of the most staunchest advocates for workplace safety and hazard prevention for nurses. And so it really, to me, is, sometimes this happens. So what I really felt when I saw that was, it was really, really unfortunate that news clip came out that way. And it was even additionally unfortunate that it got promoted, even though, it's very clear, that our position is different. It's very, very clear. So it's really important. I think it shows the importance in this moment to really, think about, what is, what kind of message are we promoting? You'll notice that interview is not on our website, and it is not on our Facebook. Yes. So, and that's, sometimes it just goes wrong, and we don't promote that ourselves just because we got press. If it's not on message, we are the largest organization of nurses in this country. And so the integrity and honesty and trust that nurses have in us is really, very important to us. And so our, control around those things, where we have it is, we would obviously not post something like that.
I think it just left a lot of people feeling like, if this is a hazardous thing, if nurses are going to be in the workplace, and we know that there's a high likelihood, where's our hazard pay? Like, where are, what I'm saying? Where are these things that nurses are getting if it's a known fact that it's probably going to happen to you? You know what I mean? And I think that's kind of how it.
So two things I have to say about that, right? It's unfortunate that if people saw, NNU's position around workplace violence for the first time through that interview, and it's rebroadcast, it's a really disingenuous, and it's very easy to find what our actual position is. You could just check our website; it's there. The other thing I would say about this is, to be clear. Our position is backed by our actions and the actions of our members across this country, and it's shown results, right, in winning the workplace violence prevention standard that is the gold standard for prevention in this country. A few points I think are really important on that, right, is first of all, we know that workplace violence is preventable. We also know that it is in the employer's responsibility and an obligation to take every measure that they possibly can to prevent it. We also know that employers don't do the things they're supposed to do. And so we have to have things to hold them accountable, like this legislation. We know that the experts on hazards in our workplaces are nurses. And so one of the key elements of this bill is that there must be nurse-led unit-based councils that address hazards that are specific to each unit. Another really important thing is while there are a lot of different legislative approaches, we know that criminalization alone is not a solution, because at that point, people have already been harmed, right? There have already been harmed. So prevention is key. Prevention is key. Further, we also know that in this legislative approach that clearly, to be honest, there are, the majority of workplace violence incidents are kicking, biting, hitting, punching, scratching, name calling. Oftentimes, it is the patient themselves who is doing this. And what you heard in part of this clip is sometimes it is a result of a metabolic derangement, right? How many times have we all cared for somebody who has prednisone psychosis? Yes. Have we cared for somebody coming out of the PACU who is agitated? Yes. Are they violent sometimes? Yes. Does that mean that we need to accept it? No. Even in those situations, there are prevention measures. And so what I believe that clip portrayed is, as you can see from that position, part of a discussion, right? We can't just criminalize patients who are having prednisone psychosis, right? We need to protect nurses, make sure there's adequate staffing, safe staffing, to ensure that we are able to watch for the signs of increased agitation, to make sure that we are able to surveil our patients and intervene before things escalate. It is also, of course, like the situation with the shooting, there are employer environmental controls that need to be put into place.
Yeah.
We started advocating for workplace violence prevention in our union in the state of California after one of our members died, after they were strangled by a cord from a lamp in the unit. And let's just say, so we know that there are multiple layers, just like there are for infectious disease, and that need to be put in place. And that is where our advocacy centers.
I did notice that as an organization, you did not repost that interview, which, is telling and good. But I also noticed, if I'm being honest, that 4 days after that interview, NNU released a statement on workplace violence in healthcare settings. And in the statement, you condemned the recent violent assaults, as you should, but notably missing was any statement about the comments that were made during the interview. Does NNU plan on acknowledging the comments that were made, or do you worry also about the damaging effects that the statements may have on current or future nurses that will think workplace violence is just part of the job?
Honestly, this is a local TV station. I think our position on workplace violence is abundantly clear by the type of policy that we are advocating, by the action that we put behind it, by the continuous workshops that we give to nurses that they can come to just by joining our nurse advocacy network, by signing on to our longstanding petition for workplace violence prevention. These things are larger than this one incident, than this one. It's not even an incident. This one misrepresentation by the press. And so if nurses have concerns, they can read the article that accompanies that.
And we'll link the article in the show notes. And I'm sorry to cut you off. I just wanted to say we'll also link that petition. I did see that petition that NNU has, and you can sign up to urge Congress to pass legislation to prevent workplace violence and make our healthcare facilities safer for frontline healthcare workers and patients. And we'll link that in the show notes and encourage everyone to do so.
Sure. Yeah. I think, really in the big picture, the advocacy, other other New York Times, Washington, other articles that we've been in, the type of advocacy that we do, the panel discussions that we have, the education that we do, not only to nurses who are not in a union through the Nurse Advocacy Network, but also to our own members and our allies, right, to our family members, patients in our communities. This, I think, speaks for itself. And so, to me, I think our record is abundantly clear for the decades that we've been advocating for very powerful workplace violence prevention standards for every nurse in this country.
Thank you.
I just wanted to say before I get into the next question, on behalf of the NNU, I will say that obviously a lot of times bad news is the kind of stuff that is people share more often. In my opinion, I've talked with Eric about this. I feel like it's a shame that the things that we really try to report on, like the good stuff, the things that are being done, or what we can do to try to make changes. Unfortunately, some of that is just perceived as, I don't want to say boring, but words, and they just scroll past it. But the stuff that's bad, like, the violence that is occurring, and, those kinds of things are the things that are going to get pushed further in the media. So, I don't want this to be like we're saying that you guys are not doing wonderful things, because I know, we know that you are, but it wouldn't, I think the nurses would be very upset if it wasn't addressed, and we didn't talk about it, because that's a discussion that obviously, needs to happen. So.
Sure. I appreciate you opening this space to this conversation, and that's really important, right? I think most importantly, as nurses and as and other people, right? That's why we have that our Nurse Advocacy Network is a powerful place for people to be engaged, right? A lot of times nurses say, well, I don't have a union. What can I do, right? How do I address this? How do I fight back? And it's also important for us to be strategic. To point our arrow at the same target. And so this is, really, important to talk about. And, and when these incidents happen, what we want to do is help nurses appropriately assign blame, right? Right. It's not necessarily, there are so many things happening that are that are creating the increase in workplace violence, right? Cost-cutting measures, speed up at work. Fewer people have mental health care. Fewer people have ability to get medications. There are so many reasons people are really, those kinds of pressures manifest to us first as nurses. And we are really right there at the crux of society and our own lives and our own health. And so having these conversations is important. It's also important for us to be strategic and use that to funnel this anger together to a solution, right? Which
I agree.
That exactly the workplace, and for us around this, we know those solutions are workplace violence prevention that covers every state, right? Federal OSHA is required because the state level does not cover. There's a patchwork enforcement mechanism, so not every state is covered. So we do need a federal law. So that's really important. Of course, we know that understaffing creates conditions that can create more violence and injury to nurses, right? So after we passed the California nurse-to-patient ratio law, we saw a 30% reduction in occupational illness and injury. Right? It just makes sense. So we know that that's it. As our union, we know we must also fight for Medicare for all, right? Expanded single payer Medicare for all. And these things are all related to each other, because if people can't have access to healthcare they need, right? If they aren't getting good care, not because we aren't providing it, but because things have hit a crisis by the time they're finally there. We just know also understaffing is related to financing. So we have to look at this from a whole package. And for us, that package is workplace violence prevention, ratios for every single patient in this country, and access to healthcare for every patient in this country.
Amen.
Yes. Yeah. Now we're going to take a quick break to hear a word from our sponsor. Eric, I started thinking about the many uses we know of for Stink Bomb Odor Blocker, our amazing sponsor, but another one really hit me, kind of like BO does. When you get that whiff of body odor, it's not good. It could come from anywhere, right? It could come from a patient, a coworker.
Yeah, I've come across that in Europe when I've been there, because sometimes they don't bathe every day, and sometimes they don't use deodorant quite as much as Americans do.
Or if you're on an airplane and you can't get out of there and somebody next to you has, what are you going to do? So you can't squirt them down with a perfume bottle. Your next best option is Stink Bomb.
Blocker.
A couple dabs under your nose. Yeah. It's just like it looks like a chapstick. Tell them about Apple.
So our new favorite is apple scent. It was evergreen, and I still love that one. But Jessica and I agree that apple is our new favorite. You got to smell the apple.
Yeah.
So good. Yeah.
Head to stinkbombodor.com and use code Uncorked15 so you can get an additional 15% off your total purchase. So on the heels of that statement, nationwide surveys conducted by the NNU found that 8 in 10 nurses have experienced at least one type of workplace violence within the past year, and that healthcare employers are neglecting essential violence prevention measures. What do you say to the individual nurse who is terrified to go to work every day? What would your words be?
Sure. Well, we know that moral injury and moral distress are real, and that they are widespread and incidents of violence, whether they have been directly at you as an individual nurse, or whether you've been around a violent incident, right? There's that trauma from that. That, it is important. What I would say first is take care of your mental health. Make sure that you're seeking the appropriate mental support, emotional support. Take time off if you need it. Secondly,
take your PTO, nurses.
That's right.
Take your PTO.
Take care of yourself first, right? You can't take care of anybody else if you're not well. It's not worth it. The second thing is start a conversation with your coworkers, right? The best antidote, the most powerful antidote to feeling alone and isolated is bringing a collective element to that, solidarity. And if you say, I can tell you, you might feel alone. Our employers shame us. They place responsibility on us for these kinds of things. They are constantly making it our fault. It's not your fault. I would say that. Talk to your coworkers. We saw the facts, 8 in 10 nurses. That means that most of the people that you work with have also been through something like this. So talk to each other, have coffee together, go on a walk together, and talk about this. Talk about the solutions. Talk about having somebody come with you to approach your boss and talk about the incident. Hold them accountable together. Really, the best thing is to be together. So first, take care of yourself and your mental health. Use your time off to heal. And secondly, bring it to the collective, right? Talk to each other. These spaces like you're having here in your podcast are so important for the health and well-being of our profession of nurses, so that we can combat our workplace violence, but so we can also continue to take care of patients in a way that isn't injurious to ourselves.
Yeah, and you're right. Chances are the nurse next to you feels exactly the way that you feel, and until you start those dialogues, like you might feel alone. You might feel completely isolated, and we're stronger with numbers. Nurses are stronger when we come together. So, and that starts, on the most basic level.
Write a letter, right? Use your pain, right? Get rid of it. Put it into a letter to your senator. Put it in a letter to your congressperson. Ask your parent, sibling to go with you to a legislative meeting. As union nurses, that is the most powerful thing we have, is our ability to act collectively together. But just because you're not in a union yet doesn't mean that you can't still do powerful things.
It's true.
And that can mean maybe you just go talk to your legislator. Say, this is what happened to me. Those personal stories and your family member, a husband, whatever, they can say, I was so worried after this happened, or I really saw the impact on my wife, my husband, and they can really, those stories are so powerful. Write a letter to the editor. Say, we need workplace violence prevention. We need this to be a priority because it's not just about nurses. It's about safe patient care, and it's about the health of our communities. So think about those types of things too, because channeling that pain and anger and outrage into something productive and powerful is really therapeutic. So I would encourage that too.
Yeah.
Thank you.
You touched on something that I wanted to circle back to because it's so important. In NNU's statement on workplace violence, it included an important but often overlooked component that safe staffing is a key foundation for effective workplace violence prevention plans. Only 17% of nurses report that their employer places additional staff to reduce the risk of violence. So first of all, thank you for including that, because I do think it's often overlooked. And secondly, what do you advise nurses to do when they are in that exact situation? Maybe they have an aggressive patient or a psych patient, but the hospital refuses to provide a sitter and the nurse has, 7 other patients. What can they do in that moment, in that shift, to protect themselves?
Again, solidarity, right? You need to come together. These require, best thing is if you work in a place where this kind of thing is happening, where you're taking care of 7 or 8 patients, that on a certain number of days, you are going to experience, you're already at risk, right? You're already at risk. So it's, just like it's foreseeable for the employer, we know, right? We can see it coming, right? We see the conditions. So grab a friend, grab a coworker, make a plan. What will we do when this situation arises, right? What do we do? How do we confront the boss to get more help? How do we demand a sitter together? As union nurses, we have protection mechanisms to use our voices, right? We can march on the boss. We can collectively sign an assignment despite objection. But as a nurse who doesn't have that advocacy tool, doesn't mean that you can't do something. So the thing I would say first is open it up, right? Hey, this is going on. Will you stand with me when I make this phone call to the supervisor to demand that we have a sitter?
That's good.
Yep. Collectivize it.
That's very good advice. How as an organization does NNU organize nurses to push the important issues forward and to communicate this information? I mean, I'm assuming, like you were saying, some things with legislation and things like that, but.
Sure. So, we have several ways. And first of all, of course, we participate in lobbying activities with our members of Congress and senators all the time, all year long, whenever we can. We communicate with the press, right? And we see, as we just saw here, most of the time it goes great. Doesn't always, but we just keep going after it, right? We have educational information to educate our members, right? Our industrial hygienists give classes on workplace violence prevention, and do some really deep case studies with our members in this way. We also know that it can't just be NNU members alone working on this problem if we want to win, right? So we have engaged community members and opened up, importantly, this space through our nurse advocacy network, sharing things on our social media, signing up through our email blasts. You can learn, okay, today is the day we should be calling this person to tell them to sign on as a co-sponsor, right? So really strategic and targeted ways, but primarily is through education, right? It is if you are experiencing moral injury, moral distress, if you have had workplace violence occur in your workplace, which we probably all have, it can be very difficult to feel like there is a solution to the problem. And it can be even more difficult when there are people around you, supervisors, management, saying, it's just part of the job, toughen up, it's your fault, you should have de-escalated, all of that. Yeah. So, really having spaces I think is for us, we know that solidarity is the most powerful tool.
Yes.
Opening these spaces is very important to us.
How does NNU ensure that the voices of rank and file nurses are heard and that they get to influence policy and strategy?
Oh, well, there's a lot of ways. Of course, National Nurses United is a democratic union. So first and foremost, we our board of directors, our executive boards, they are elected. That's really important, right? They're elected by membership for representation. So that's the first thing. Second thing, when we do things like education interviews, collective, we report to them, of course. So there's accountability built in there. And then we primarily feature our members and our nurse leaders in discussions, like panel discussions or the nurse advocacy workshops or in media interviews. Our presidents, our elected presidents. So there are many ways that we center the voice of our members. We have a network of collaboration, of course, through our Joint Nursing Practice Commission, which is a national professional practice committee chairs that come together where we evaluate the types of things that are happening in the facility levels and the region and across the country. And of course, working with our affiliates, right? We represent nurses in 43 states. So together, we really do have a broad picture of what's happening throughout the country by advocating from the bottom up.
For those nurses that are not unionized, what advice do you have for them to try to organize and try to get something going?
Sure. We're all patient advocates, right? And we all care a lot about our profession. And so it just makes sense, right, that you would want to use every tool available. When you are a member of a union, you have rights that are protected by law in a way that is different when you don't. So that's really important. I know you guys talk about that a lot here, so I won't go on that too much, but really, again, you can go to our website. You can go to nationalnursesunited.org, organize, and you can sign up and somebody will contact you. And even if it's not the time is right, you can then also join our nurse advocacy network, right? And learn about the ways to be an advocate for our profession and for patients without necessarily joining a union or while you're organizing a union. So the first thing is contact us. And we have organizers on staff who are experts in assessing and facilitating a campaign to bring everybody together to win. We're the fastest growing union in the country and are very successfully organizing nurses in places where the labor movement didn't really think you could win, like North Carolina, like New Orleans, like Texas. And Florida.
Maine Medical Center.
Exactly. And so, the thing is, don't be afraid, right? Don't be afraid. It takes nothing to just say, hey, you never know. There may be other nurses from your own facility who already contacted us. So, and if it's not time, there's so many ways to learn how to build a network and be a part of the nursing community that is fighting for healthcare justice. And we want you to be a part. There's always room for you in NNU.
Awesome.
Yeah, I send nurses to the website all the time. It's nationalnursesunited.org, because I will say that you guys have made it so simple and I have tons of nurses reaching out to me every day. How do I unionize, Erica? What do I do? And so I run through the whole spiel with them and I say, a great place to start, go to that website, because they've made it so easy. I think it's right under organize on the homepage. And it's just like a little 6, 7, 8 question thing, super quick and easy. Basically contact information. And then one of the organizers just reaches out to you and you take it from there. So the first step is so simple and quick. I mean, you can't beat that.
Even if you're not there, you can join, you can become involved by community, by region, right? We know we are building a nationwide movement and, ideal, you get to organize a union in your facility. But there are so many other ways to be involved. And, that I just want to emphasize that you don't have to, even if you're not ready to fill out that organizing form, even though it's so easy, you can still come to our NAN, and all of the other ways to be involved.
Nurses are being overworked and understaffing is getting worse, unfortunately. What specific actions is NNU taking to address the critical issues at the local level and not just on the national stage?
Sure. So, well, first, our collective bargaining agreements are the most powerful tool, right? Legislative advocacy is great, but the law can change. We know that. And so, we are able to win and secure things like the workplace violence prevention standards, things like, equity and inclusion protection, things like, safe staffing standards or building up to that through contract negotiation, right? And those things, even in California, securing the California ratio law in the contract, right, as an extra layer of protection. So those things are really important, not to mention things like grievance and arbitration. So, and then of course, working through systems like Hospital Corporation of America, Ascension, Kaiser Permanente, Tenet, all of these divisions. So divisional power is also great, right? We have built critical mass in these systems so that we have collective bargaining power in that system. And that is, really important, right? So we've got nurses from Hospital Corporation of America who can compare notes, right? And decide what the bargaining priorities are for themselves. When it comes to safe staffing, we do have state legislative initiatives, such as in the state of Illinois for minimum mandated nurse to patient ratios. In New York, NISA has a bill, Michigan, so there are many different ways. And then there are other ways that may not seem quite as apparent, right? That we advocate through different legislative policy, advocacy at the state and regional levels, like through our work through HICPAC, right? That is the Healthcare Infectious Control Advisory Committee. That's really important. But then at the state level, we may also be doing different work with state regulators to protect, for example, something that's under assault right now, our Nursing Practice Acts, right? The delegation language that ensures that the registered nurse has the right to control decisions around delegation. This is under attack nationwide. So there's so many different ways that we do that through the various resources of the organization.
So really quickly, just following on the heels of you mentioned earlier about Medicare for all, why do you think that is so important? And can you tell us what it is for those who may not know? What does it mean?
Sure. Well, first I'll say it's probably a little bit more of a discussion. I would love to come back and talk about Medicare for all. But it's a whole thing. I think a lot of people have questions, and I think what I do know is a lot of people, as nurses, we see firsthand that people don't have all the healthcare that they need, even if they have insurance, right? We know that the insurance system in this country is scooping profit that could go towards patient care. And even we saw like this past year, United Healthcare building AI that was systematically denying patients care, even if they should have gotten it. So we know that system is dysfunctional. We know that we spend more money on healthcare in this country and have among the worst outcomes in developed nations. That's unacceptable. So I agree. And when it comes to staffing, what we know is that those profit motive is what is creating decisions to cut back on resources for nursing care. And so when you take away the profit motive, right, which is the center of our healthcare system, and increasingly so, as venture capitalists and investors are buying up healthcare in this country, it is bankers who are running healthcare in this country more so than healthcare providers. So that's just fundamentally wrong. I think we can all agree on that.
Yes.
And so what Medicare for All does is it shifts away all of that middleman money via healthcare insurance denials, and it puts the priority on patient care, on preventative care. And actually, Medicare is really efficient and it works really well. However, it has been under assault, right? There's a lot of money there. And we even see Medicaid, for example, and Medicare under attack right now. And so, people want to raid that coffer. And so when we've seen that happening over time. And so what the Medicare for All or single payer healthcare for everybody does is it takes away the profit motive. It places the priority on health for Americans, for everybody, the health of everybody. And it really fundamentally uses a system that works well when it's not getting rated and the funds are being taken away. So just in brief, if you want to read more, we do also have many resources on Medicare for All on our website. And we frequently do educational sessions on, through the Medicare for All campaign. You can, when you sign up, that's a great place to learn. I think it's one of the areas as nurses that we can really be much more powerful advocates to flip the narrative away from profit to actual healthcare.
I completely agree, and I fully support the push for Medicare for All, and I think everybody should get behind that. In my opinion, it would absolutely change the playing field altogether in our favor.
All right, let's quickly give away our weekly Enema of the Week award, brought to you by Happy Bum Co., the leader in at-home enema solutions.
Enema of the Week!
So, Erica, last week when we talked about our sponsor, Happy Bum Co., you mentioned about colonics and colonic therapy, and I was not that savvy with it. So I looked it up to just kind of get a better image. And I will tell you, these people do not look happy. They look very uncomfortable and very embarrassed. If you're watching the video of this woman she looks like she's very shy. There's somebody that's about to do something to her, which reminded me of how amazing our company, Happy Bum Co. is, because it's something that you can basically do the same thing, but in the privacy of your own home, right?
Yeah, leader in at-home enema solutions. It's a way to give yourself safely and effectively an enema at home. Colonics are useful sometimes, but it does come with a certain amount of embarrassment. People might shy away from doing it. Yeah, you don't have to worry about that with Happy Bum Co. They send you everything in the bundle, and you can do it yourself at home when you want.
Check it out. There's no embarrassment involved. So make sure to head to happybumco.com and use code Nurses Uncorked for an additional 15% off your first bundle. So, Erica, who is getting the bad enema this week?
I hate to do it, but it's got to go to the Georgia Nurses Association, who put out an ad, which I think they may have taken down since then, as they should, but nonetheless, they did put it out in this past week post these two horrible nurse assaults, offering de-escalation training for nurses, putting an end to nurse abuse, virtual de-escalation training for the low price of $140.
Oh, no, I hadn't heard about this. Are you serious?
Yes. So many people sent me this, like, they must be Georgia nurses. They're like, what kind of timing is this? That's literally victim blaming. First of all, de-escalation training doesn't really do a lot in these severe circumstances.
Well,
secondly,
they're charging for it.
They're charged. I mean, it's less if you're a member, but they're still charging for it. Yeah. And then if you take it, inevitably that's going to be weaponized against nurses, because then employers are going to say, well, did you use your de-escalation training?
Oh my God. Oh my.
Yeah.
I was about to say maybe they just goofed up and they're like, let's come up with something that sounds good. De-escalation. Yeah,
that's their fucking PR.
But then it's probably bad timing to fucking be charging people too.
Right? Yeah. And it says this affordable and highly effective training will teach nurses the skills and techniques to mitigate verbal and physical abuse in the workplace and more.
Sir,
I'm going to need you to calm down.
Yes.
We're going to need to use our inside voice.
I know you're upset.
I know you're wielding a
and
machete.
you feel this way. But
to respect.
Yeah. Meanwhile, he's jumped on you and he's strangulating you as you're
What's
trying
strangulating?
I don't know, but it's bad. It's really bad news. That's all I got to say.
Oh, come on, Georgia
all right.
Nurses Association.
Well deserved.
Read the room.
Hey, Georgia Nurses Association, if you'd like to come on, Erica's got some questions for you. Come on the
everyone's invited. We invite
Yeah,
everyone.
We'll take every Nurses
You
Association.
want to talk about it? Sure.
Yeah.
We've had a few on now.
Great. Enjoy your award.
Lastly, I just wanted to ask you, I think sometimes people that are not unionized or are not part of NNU can find it to be a little bit confusing because you are so large and you do so much. So I was wondering if you would just kind of briefly explain the different parts, because you have kind of different arms of NNU. You've got, of course, NNU and the California Nurses Association, but there's also the National Nurses Organizing Committee and the Global Nurses United. Can you just kind of break that down for us?
Sure. So, also, if you would have me back, I have a deep dive on various history of nursing organizations.
I would love to.
Really an important part of this discussion. But in brief, National Nurses United is created in 2009 to bring together the nurses from many of the nursing associations who left the American Nurses Association, like California, to bring under one house, with nursing as the priority, with patient care as priority, a national movement for nurses. It's an affiliation structure. So there is the California Nurses Association and National Nurses Organizing Committee, which are together through NNOC. There we organize and represent nurses across the country. And then there are other affiliates like the Minnesota Nurses Association, Michigan Nurses Association, New York State Nurses Association. And Maine, for example, is part of the National Nurses Organizing Committee. And so part of the reason that it looks a little bit like this is because of the evolution of who left when and what kind of organizing back in 1994 when CNA left the ANA. They knew that they had to rearrange to build power to fight for things like ratios. And then later, everybody in 2006, CNA members voted to build a national movement. And then we were able to form National Nurses United. So it's a little bit confusing, but if you think about it, it's just a new home for all nurses as part of a national movement with the integrity that we should have had in all along, right? To fight for the things that we really need. And then secondly, so what we did, we also know that we don't nurse in a vacuum. That increasingly global forces influence our practice here in the United States, and that the global nursing workforce is increasingly impacted by businesses, by companies, by global corporations that are impacting global health, right, and doing some of the same things that we are experiencing abroad. Not to mention that we all share a common bond around some of the basic challenges, albeit to maybe varying degrees. This prompted the initiation of the formation of Global Nurses United, where now we have over 35 countries as part of a global network to organize on a global scale. And there we've been able to do important work, like hold national global days of action, bring important issues to the attention of the World Health Organization, demand, particularly during the early days of COVID, we were able to meet directly as nurses of the planet with our union siblings in Spain and Italy who were experiencing COVID in a way that we were just about to, and learn what we needed to do, as well as looking at things like climate crisis and global infectious disease, patterns. So that network is really valuable and super important in this moment when we need international solidarity more than ever.
Yeah, I will say that you, as an organization, certainly did so much more during COVID, especially early COVID timeframe, than the ANA did for nurses. I remember them saying one thing publicly, but you guys were out there all the time. advocating for nurses and the PPE and all of that. So
absolutely.
thank you.
Yes. I mean, it's part of our work. You may have seen, Jane Thomason, you can still watch her, was on the national news briefing about the danger of COVID in January of 2020. That was hosted by our executive director, Bonnie Castello, and Jane Thomason, our industrial hygienist, with a report that we put out saying we're not ready for a global pandemic. And, that of course was so unfortunate and prescient that we in fact were not. It was really talk about flexing the advocacy muscle. Our members across the country, we're holding live press conferences outside their facilities, and we held thousands of actions in 2020 alone. It was, it's through some of the worst challenges, we also learn that there can be opportunity. And I would say that the opportunity that arose and carried us through COVID was the increased profile of registered nurses and the importance and value of their work to everybody in the world.
I would love to have you back at some point in the future and talk about kind of the history of nursing unions in this country, because that is fascinating. And I think it's educational for people that aren't part of a union to understand what has gotten us to this point and how important unions are. So please, open invitation for that. And I just want to thank you for coming on the podcast and for, not shying away from the difficult questions. We appreciate that. Thank you.
Well, thank you. It's really nice to meet both of you. And I really enjoyed this time together and look forward to future conversations. Thank you so much.
I think that's wonderful.
Thank you, Michelle.
Nice to meet you too. All right. Well, guys, I guess until the next time, and the next time that we possibly have Michelle back on the next Nurses Uncorked.